Infectious disease is a major cause of morbidity and mortality in the United States. However, it's generally preventable with regular recommended vaccinations. Even so, in order for individuals to obtain vaccinations, they should not only be visiting a primary care physician regularly, but also be able to afford these immunizations. Either of these may not be possible for individuals that are using free clinic services for healthcare. The Camden Community Health Center is one such clinic, a student-run free clinic that provided primary care services regardless of insurance status from 1999 to 2018. After a one-year hiatus, the second iteration of the clinic was opened a few miles away in Lindenwold, New Jersey. Almost 90% of the patrons of the clinic are residents of Camden County. Under the assumption that those who are using free clinic services may not be able to afford regularly following up with a primary care physician, a doctor that could educate them on staying up to date on immunizations and the importance thereof, we reviewed almost 20 years of chart data to determine immunization coverage among the patient population of this clinic, how it compares to county and national data, and what steps to take in order to increase immunization coverage at the reopened clinic. The study was an IRB-approved retrospective chart review of individuals that visited CCHC for primary care services. This included 1,182 visits, 60% of which were physicals or well-child visits during which you would expect immunization history to be collected. Only about 39% of those visits did have the relevant information. We collected from these charts demographic and vaccination information, such as combined 7 series vaccines, meningitis B vaccinations, HPV, and the annual flu shot. Immunization rates and percentages from the clinic that were calculated from the clinic data were then compared with that of Camden County and the U.S. as a whole. County data were obtained from the New Jersey State Health Assessment data and New Jersey Department of Health, and national data from the Centers for Disease Control National Health Interviews Survey. 57% of our population was female, and over 76% were adults over 18 years of age. Average age of children was 13, and that of adults was 40. What we found was that overall vaccination rates, which basically included having any vaccination at all, even if you did not complete a series, for example, the full MMR series, even if you got only one shot, was about 30.9% in children and about 69.1% in adults. We then specifically looked at combined 7 series vaccination and influenza. The combined 7 series vaccination rates shown here in the second graph on the right, on the top right, were rates among children 19 to 35 months old. And these rates show whether they were up to date based on their age. About 50% of the CCHC children that visited the clinic were up to date, whereas Camden County data collected from the school students enrolled in school was about 95.6, and national data the rate is about 70%. For influenza vaccinations, this was rates among adults greater than 18. That of the clinic was only 6.5%, whereas for the county it was 48.7, and for the U.S. 45.3. So as you can see, it was much lower for that of the free clinic population. On the bottom, we basically broke down the 7 series vaccines just to show you rate across the board. And then here at the end, we have HPV rates, and this is comparing the CCHC data with that of the U.S. As you can see across the board, the vaccination rates for the clinic were much lower than that for the U.S. as a whole. Again, the first 6 were from the 7 series data, so that's rates among children 19 to 35 months, and the HPV rates were among adults 18 to 26. Because vaccination coverage was across the board lower among the clinic population than those for county and the nation, it's likely that there's either an accessibility, affordability, and/or education issue or limitation among the clinic population. Unfortunately, our comparisons cannot, because this is retrospective, cannot really go delve into those. We can only make certain assumptions, and we are also limited in our comparisons based on what's available from both the county and CDC data. One thing of note for us was that many of the charts were missing immunization status and immunization history, and that's just showed a lack of uniform data collection in the past 20 years. So based on our information and what we gathered, really the most important thing for us that came out of this was next steps to take in order to increase vaccination coverage for both our clinic as well as similar clinics that are being run by other students or other free clinics. One step to take really is to reach out to and partner with local organizations to ensure that proper referrals for free or affordable services are made. There are a number of both counties and city organizations that can provide free or lower cost vaccinations if that's not provided by a clinic. The second step then is to also try to procure vaccinations and administer them at your actual clinic, which we are attempting to do. Also develop educational programs in order to increase awareness about the importance of regular immunizations and staying up to date, getting boosters, especially in the current healthcare climate we're in. And then for us individually, implementing electronic medical records for consistent healthcare information and proper follow-up. Basically, what we're hoping is that if you take these steps, we can increase immunization coverage, which will allow for decreased morbidity and lower healthcare costs as well.